So, hi everyone, and welcome to our question and answer session with our dermatologist, Dr. Reid. Thank you so much for doing this for us today. I know you are quite busy yourself. So, Dr. Reid, tell us a wee bit about yourself before we start the questions.
Sure. Hi everyone. My name is Dr. Neanda Reid. I'm a board certified dermatologist. I live in Pennsylvania, in USA. So I live right outside of Philadelphia, and I practice mostly general medical dermatology, some cosmetic dermatology, as well as surgical dermatology. Fantastic. Thanks for having me.
As I say, thank you very much for taking the time out of your busy schedule. So if it's all right with you, will we get started with the questions?
Sure.
So, what is lupus and what causes it?
Okay, so that's a great question. So lupus is an autoimmune disease, meaning that it's caused by the immune system attacking its own tissues and organs. So it can affect almost any organ in the body. It can affect the joints, the skin, the heart, the lungs, the brain, the kidneys, and the blood. So actually the skin is the #2 affected organ in lupus. A lot of people don't know that or realize that. So you can have a lot of skin symptoms with lupus. And sometimes there's also an overlap with other connective tissue disorders, such as scleroderma, dermatomyositis, rheumatoid arthritis, or Sjogren's. So there are a lot of other connective tissue disorders that overlap with lupus. There are a variety of presenting symptoms. So as you mentioned, sometimes some of that can be missed early on. So it's important to really know the overlap as well.
Yeah, definitely. And I think that's what makes it so hard to actually get it diagnosed, isn't it? The amount of overlap.
Exactly, yep.
Okay, next question. How important is sunscreen for those with lupus?
So lupus actually causes an increased sensitivity to UV rays or sun rays. And so sunscreen, in particular, sun protective factor 30 and above, or even higher in some cases, as well as other forms of sun protection, a hat, sun protective clothing, is very important in patients with lupus because UV light actually can cause flares in cutaneous or skin lupus, as well as systemic lupus, or what affects the body inside. So it's really important, and we tell our patients all the time how important sunscreen is in the general population, but even more so for patients with lupus.
Fantastic. What kind of skin problems can occur for lupus patients?
Okay, so there are actually a lot of skin issues when it comes to patients with lupus. So as we talked about, systemic lupus is an autoimmune disorder, and the skin is the second most affected organ. There are different types of lupus. There can be systemic lupus, or SLE, people know the term. There can be cutaneous lupus, that includes discoid lupus, some other forms of lupus, something called tumid lupus or lupus paniculitis. There can also be a form called drug-induced lupus, as well as neonatal lupus for babies. And so the classic skin sign in acute lupus, people really know the classic butterfly rash or the malar rash in acute lupus, and it looks a little bit like a red-purple rash on the cheeks, and it spares the nasolabial folds. There can also be alopecia as a presenting symptom of skin lupus or lupus in general. That alopecia or hair loss can be with or without a discoid rash. So basically the involved areas that are typically the ears, the scalp, and the face. You can also have oral ulcers, which some people don't really think about as a sign of lupus, but you can have mucocutaneous symptoms as well as a subcutaneous type lupus where you have a rash on the trunk. And in terms of non-specific lupus symptoms, you can have things that go along with other autoimmune disorders as well, like photosensitivity dermatitis, or a rash from sun rays is a simple way to put it. And you can also have things like vasculitis that's found in other autoimmune disorders, where you have inflammation of the blood vessels leading to changes in the nails. And something called Raynaud's phenomenon is quite common as well, and definitely an overlap with other autoimmune disorders where you have purple and basically skin color changes in response to cold temperature because of low blood flow to the extremities. So a lot of things, lupus can honestly present a lot of different ways. So it's really important to know all those different ways and to really be alert when it comes to, getting a diagnosis.
Yeah, definitely. And again, goes back
Yeah,
to that whole point of it being so difficult to diagnose.
exactly. Yeah.
So what are the side effects of lupus medication?
Okay, so the types of drugs that we have to treat lupus include what we call NSAIDs, which are which are anti-inflammatory medications. Most particular, we use a lot of corticosteroids or steroids, but we have also other immune system suppressing medications. Two types of antimalarials as well that we use most commonly are hydroxychloroquine and chloroquine. And a lot of these drugs can cause symptoms, like nausea, vomiting, headaches, dizziness. They can affect your blood counts in some cases, as well as your heart rhythm in some cases. We mentioned oral steroids are pretty common. Oral steroids like prednisone can be used quite often to control lupus flares, and they can affect other organs as well, especially long term. Steroids can have a lot of chronic side effects like weight gain, mood changes, and long-term can affect bone development. You're at risk for osteoporosis and bone disease and infections. Also, people with diabetes, can also increase your blood pressure. So a lot of the medications that are used to treat lupus can have side effects, and that's also something important to keep in mind.
Yeah.
There's also newer biologic agents as well as other immunosuppressive agents, and that can also lower your immune system.
Fantastic. So what causes lupus skin flare-ups?
So like we talked about before, the sun. So any UV rays can cause some photosensitivity and cause a flare. So UV exposure, I would say. Stress, believe it or not, can cause flares of lupus, which we're all feeling right now in 2020, I'm sure. Other illnesses and infections can cause flares of lupus. Pregnancy and other hormonal changes can also cause lupus flares, and certain medications, especially in drug-related lupus, so certain blood pressure medications, for example. So lots of things to keep in mind as a patient with lupus for yourself. And but again, things that you can control, sun protection is a big thing that you can control. So I would say if you're a patient with lupus, really control the things you can control. Protect your skin, make sure you're aware of what your medications are. If you're not controlled, see your rheumatologist or your dermatologist if you're having skin symptoms, and really be involved in your treatment.
Definitely. I think that's key, isn't it? Yeah. So what is the best way to treat the butterfly rash?
So the butterfly rash, when we do see patients with butterfly rash, we really try to treat them first with anti-inflammatory medications. Topical creams can be used, non-steroidal anti-inflammatory topical medications can be used. But sometimes if you're having a flare on your skin, that's an indication that you're having a flare somewhere else in your body. So we do make sure your lupus as a whole is controlled. So we definitely rely on partnering with your rheumatologist to make sure you're on the correct medications, or that you're on the right dosing of those medications. So sometimes the skin can really tell you what's going on inside of your body.
It's really interesting, isn't it? How it manifests. Yeah.
Yeah, exactly.
Is there a safe skincare regime, or is it just trial and error?
So I would say, like any skincare regimen for any person, even if you don't have lupus, is trial and error. And sometimes that takes a long time to develop. A skincare regimen is unique, right, to an individual. And it starts with your own skin type. It starts with oily versus dry versus combination, versus sensitive. But when you have lupus, you have another level of type of lupus, for example. How well is your lupus controlled? What medications are you on? Are they photosensitive medications? If you have lupus, you have to be really careful with regards to photosensitivity. Again, sunscreen will be your most important part of your skincare regimen as a lupus patient, as well as any of your prescribed medications. So I would start there, and all the other things are secondary.
Okay, fantastic.
Yeah.
So can I still get laser treatments or any skincare treatments with lupus, or?
That's a really tough question, because certain procedures, actually like laser treatments or light treatments, can exacerbate lupus and cause lupus flares, especially if the patient is not controlled. So for example, the pulse dye laser has been used to treat telangiectasias or blood vessels in lupus patients, but there's definitely a risk of pigmentation and scarring.
Okay.
So if you're seeing anyone for laser treatments, make sure they know about your diagnosis of lupus. Make sure, you are being treated appropriately and you see your rheumatologist before receiving any other skin treatments, because you want to make sure that your lupus is controlled before you seek any kind of laser treatments. And it also depends on the type of laser and the person doing the laser is experienced in treating people with rheumatologic disease.
Okay. So does lupus affect our wound healing process?
Yep, it sure does. So slow healing wounds are actually one of the complications of autoimmune disease in general. This is, of course, worse in people with a history of vasculitis or inflammation of the blood vessels, or people with a history of recurrent infections, for example. And if you're on immunosuppressive medications, you are at risk for increased infection. So all that plays a role. But the short answer is yes.
Okay. So how can we treat or reduce the scars that we do get from sort of lupus and from any scars that we've got?
Okay, so prevention and control of disease is super important. I always tell my patients the best way to treat a scar is to prevent it. So sun protection is important to decrease photosensitivity. Seeing your rheumatologist and dermatologist regularly, especially if your disease is not controlled or if you're flaring, is also important. Discoid lupus can, actually have this classic hyperpigmentation or darkening of the skin at the borders, and then a central atrophy or scarring in the middle, and especially on the scalp, ears, and that's really, really, really difficult to reverse. And so that's why I'm pressed to say that early treatment is key, and early diagnosis, early treatment regimen, and management is also key.
Fantastic. Thank you so much for taking that time. That is all our questions that we had answered. So
awesome.
Thank you very much for taking that time and answering the questions. I'm sure if the audience have got any more, they can reach out to me and I can reach out to you, and we can see if there's any more that we want to get answered. But I'd just like to say thank you again, and obviously thank you for the audience for watching, and look out for what's to come for the rest of Lupus Awareness Month. So thank you.
Awesome. If you guys have any questions, feel free to DM me. It's Dr.Neander Reed. Thank you.
Thank you.